This is Krista Michener. Welcome back to Made to Be Whole. Today we're going to talk about biofilms and their role in chronic infection. Stay tuned. Made to Be Whole is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on Made to Be Whole. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing. Welcome back to Made to Be Whole. I'm really excited to talk to you today about biofilms, which is one of my favorite geeky topics ever. So biofilms are basically this protective armor that your body makes when there's infection present. And biofilms are present in most infections, even infections you haven't had very long. If you've had a sinus infection, an ear infection, bronchitis, biofilms start to form pretty quickly. And the CDC even acknowledges that in virtually all chronic infections, biofilms are a factor. And in this world of vector-borne infections that I spend a lot of time in, you hear people talk a lot about it. They talk about biofilms and what are you using for a biofilm buster. I think that that broad approach is a good start, but it falls short. Biofilms are ubiquitous, but they're not homogeneous. So that means they're everywhere, but they're not all made of the same things. So you can't just say, oh, here's my favorite biofilm buster. I like using stevia. Oh, I think this is a better biofilm buster. Your biofilms are pretty diverse, but thankfully there is science now that helps us figure out what they look like, what they're made of, and then allows us to make more targeted decisions as far as treatment and what we can do to disrupt those. Marna Erickson is a scientist who's done a lot of amazing things with imaging as far as biofilms go and chronic infection. And I remember when I first saw a presentation with some of her work, the person presenting talking about these beautiful pictures, and I thought, you guys are weirdos. But now whenever I see these pictures, I'm sucking it up. I'm like, these are amazing. They're beautiful. So when she spoke at ILADS in this last November, there was a slide that listed all the places that biofilms have been detected in Bartonella specifically. Bartonella being one of those vector-borne infections that can come from a tick, but also from fleas, sandflies, other insects, causes vascular inflammation, can cause neurological problems, pain, psychiatric problems. But here's a list of some of the places that biofilms, Bartonella biofilms specifically, have been found in the human body. So the skin and all the different layers of the skin, the dermis, the vasculature, your lymph system, melanoma cells, they've been found in bones, eyes. That's one reason I think that's important to consider. A lot of people have visual symptoms with infections, but they go see optometrists and ophthalmologists and have these normal eye exams, and they say there's nothing wrong with your eyes, but the person knows, but my vision's blurry half the time. It comes and goes. So biofilms could be part of that. They've been found in the brain, the cerebrospinal fluid, lymph nodes, urine, the appendix, the placenta. We know that there can be what's called vertical transmission, mom to baby, in blood and blood components. So red blood cells, white blood cells, endothelial cells, saliva, teeth, the colon, the heart, including heart valves, the liver, and then they've also been found in catheters. Like if somebody has a PICC line, which is a peripherally inserted central catheter, which is a long IV that can stand for a longer period of times. Certainly catheters that are used in the urinary tract. So there's probably more than that, but that's a pretty big list and should give us an idea of how critical this is to understanding and treating infections. And bacteria living in a biofilm are resistant to antibiotics. So I mentioned in a previous episode, but it can take 1,000 times or more the dose of an antibiotic to get the bacteria in a biofilm compared to what's outside the biofilm. So it really, really is critical to address these for someone to get well and stay well. Most of them aren't really films. We think of a filmy coating, just kind of like slimy armor. I use it as an example, but they're made of lots and lots of different things, and that's where imaging and advanced laboratory testing comes in. And there are some interesting pictures that you can find in the scientific, literature, and I'll put a note in the show notes with a link that shows some of these illustrated models showing the bacteria and all of these things that surround it, and it's kind of an aggregate of defenses, and it's a really good illustration on why this is so difficult. There are patients who want me to just give an antibiotic, or they'll say, "Well, I just wanna take one biofilm buster. I'm taking this. This should work. I've read about it." But they're a lot more complex than that most of the time. So I think that the 2 best tools out there, at least that I'm aware of, for evaluating your biofilms, one of them is imaging through T-Lab. We've talked about T-Lab before. I love this lab. Their website is tlabdx.com. So in addition to checking for actual infections, looking for the RNA of the bacteria of Bartonella or Borrelia or of the Babesia parasite and be able to capture images of that, they also have what's called a BNR report. So the BNR stands for biofilm, neutrophil extracellular trap, and red blood cell inclusions. So they will send a picture of images that are representative of the biofilms that are there, and then along with that, a description of what they appear to be made of. Like, some of them will say they're platelet dominant biofilms. That gives me good information because I know there are certain things that work well against that. So a couple of the things that I recommend are timed release niacin, which is vitamin B3 that has good activities against that. Or Dr. Zhang has an excellent supplement called Circulation P that has some Chinese herbs that it can address that. There are some other more aggressive things we can do just depending on the situation. But we can look and make a determination about the extent of the biofilms. We can see how coagulated or clotted the blood is around the biofilms, and we've got something to work off of. Neutrophil extracellular traps are what they sound like. Neutrophils are a type of blood cell that are part of your immune system, and they will go create these blobs, not a very scientific word, but these traps, these blobs where they're trying again, this is your immune system trying to help you out, like, there's an offender here. I'm gonna go seal it off. We're gonna use our defenses to get this thing out of the way. But the problem happens when you have a chronic infection that's widespread, that in the case of Bartonella, for example, is in your vascular system, is in your red blood cells. And if you end up with these biofilms and NETs, neutrophil extracellular traps, plus the red blood cell inclusions throughout your body, not only is that infection well protected, but you've got the additional problem of those defenses, those devices are going to cause problems for for your health as well. They're gonna affect circulation, pain, all sorts of things. So, biofilms, because they're diverse, it's not enough just to say, "Hey, here's a biofilm buster." Another tool that we can use is a panel that I have referenced before. It's called a hypercoagulation panel. It was developed by Ruth Kriz, Ariz, who's a brilliant nurse practitioner who really delved into the role of biofilms in chronic urinary tract infections. This particular panel is through LabCorp, but it's something that's frequently covered by insurance. And I'm going to go through some of the components of it because this is something you may be able to get your provider wherever you live to order if they use the right diagnosis codes. And I will put a sample lab order in the show notes too, so that you can see all of the different components and some of the diagnosis codes that we use. So it looks at fibrinogen activity, prothrombin fragment 1 and 2. I'm just going to read through the components, then we'll talk about a few of them. Thrombin, antithrombin complex, alpha 2 antiplasmin, activated protein C, resistance with reflex to factor 5 Leiden. So what that is, if that level is abnormal, then there's a possibility you can have a genetic mutation called factor 5 Leiden that makes you in a more hypercoagulable state, or you're basically more clot prone. So if you've got an abnormal activated protein C resistance, then they'll run the genetic thing. They do the same thing with Pi1 activity. So Pi1 is plasminogen activator inhibitor 1. So that's an interesting one we'll delve back into here in a little bit, but that is something else that's checked. And if that's abnormal, then that will reflex to check for a gene that can affect that. It also checks for lipoprotein A, which is a type of cholesterol, homocysteine, which is a marker of vascular inflammation, and all sorts of other things, protein S activity, and another gene mutation, the factor 2 gene mutation. So you do not need to understand what all of those tests mean. You just need to know that these are all things that could give us clues to whether or not your body's in this hypercoagulable state, and which can really affect your ability or lack of ability to clear chronic infections. So I'm going to go through with you what my results for that test were, so you've got a little bit of a better idea what we can do based on that. So when I got my results, I was a little shocked because I mean, I knew I was sick. I knew I had these infections, but kind of prided myself in my heart health and my exercise and taking good care of myself, and it turns out that maybe I wasn't in as hot a shape as I thought. So the changes that I made to start with based on my result, first of all, I had high lipoprotein A. Lipoprotein A is basically a type of bad cholesterol that can contribute to biofilm formation. So because of that, I looked at my different options. I decided to go with the time release niacin. It's really important with niacin, which is B3, that you have the time release version, because if you have the regular release, it can cause flushing, which can be really uncomfortable. I take 500 milligrams twice a day. You can do it up to 3 times daily. It was really interesting to me. I try to start one thing at a time, so you've got data about what's causing what, good, bad, ugly, nothing. You can evaluate your choices. So after I started this for a couple of weeks, especially when I lay down at night, I could just feel my heart pounding, like things were working harder to get through. And I think in the context of some of the uncomfortable things that can happen to us during treatment for health problems, reframing is really important. I knew that it wasn't because niacin is dangerous or that my body didn't need it. I knew that this was probably because of some restructuring and positive work that was happening in improving blood flow and helping circulation. And that persisted for a few weeks and then it passed. So I went ahead and did that. My homocysteine was higher than it should be. It was 11.3. You really want it under 10. I had recently started Embrace, that methylated B vitamin supplement that we talked about that helps reduce homocysteine. So I just continued with that because I hadn't been on it for very long. My fibrinogen was really much higher than it should be. So fibrinogen, the reference range that usually comes back to us, just a little tidbit about different labs. They have different reference ranges. So what might be a normal or abnormal level at one lab might not be at another, and you have to look at that because sometimes that has to do with just slightly different standards, but sometimes that has to do with the way the lab sample is, like, prepared or diluted. So a level that may be high with one lab, you retest through another lab, and it's a little less or a little higher even, but it's not high, it doesn't mean that that's wrong. You've just gotta look at these different reference ranges. But my fibrinogen was high even by lab standards, so they put the reference range as 160 to 420. We know in the context of chronic infections that you really wanna be like 225 or lower, and mine was 483. Not totally surprised, but a little disappointed. So I had taken lumbrokinase for a while and stopped because of that and one other result that I found. I started and I switched to Baluchi lumbrokinase. Baluchi is the type of lumbrokinase that has the most data surrounding it, the most research. The other reason I decided to restart lumbrokinase and plan on just staying on it is because I tested positive for this pi1 genetic mutation. So when you have genes, every gene has 2 pairs that we're looking at, and so you can be heterozygous or homozygous for a certain gene. So we know this happens, you probably did in high school biology, the little charts where they talk about, okay, mom has XX, dad has XY, what are all the different gene combinations that can happen? So I am heterozygous for this pi1 polymorphism, basically this genetic variant. So I've got the 4G, 5G deletion insertion allele. That's a mouthful. What does that mean? Well, let's talk about what pi1 is. So pi1, like I said before, is plasminogen activator inhibitor. So plasminogen activator, so the first part of that is something that causes plasminogen in your body to become plasmin. And what does plasmin do? It's important. It breaks apart fibrin and clots. So it is helping prevent overclotting. But plasminogen activator inhibitor 1, which we're looking at here, blocks the formation of plasmin, and what that means is your body has a decreased ability to break down clots. When you have higher levels of pi1, meaning you have less ability to break down clots, you have an increased risk of heart attack and stroke. It also affects miscarriage risk. They found that it impacted people's response to COVID. It can impact mood, which makes a lot of sense if you think about if you've got this hypercoagulable state, so more clotting than should be there, that doesn't just affect the blood vessels around your heart or in your legs, you've got blood flow to your brain. It can affect asthma. It can even affect diabetes and insulin resistance. When you have increased pi1, you've got increased clotting, increased fibrosis, and worse outcomes in the context of these infections. Occasionally, someone has decreased pi1, that's really rare. Those people would have increased bleeding risk. So there are things that you can do outside of really extreme interventions or panicking. The thing I tell people about this report, if you get it back and it's a train wreck, what you need to say to yourself is, okay, whether or not I ran this report and had this data, I was a train wreck. By knowing it, I can prevent negative outcomes and I can help maybe undo some things that haven't been going very well. So, strategies to actually help with that, some of them are the things that help everything, like a lower glycemic index diet, regular exercise, resveratrol, which is grapeseed extract, is very good. There's a form of that known as Vinia that's got some great research because it's longer acting. Most resveratrol is in and out of you pretty quickly, but Vinia is not, and you can purchase that on our link to Doctor Supplement store. I'll put a link there. Antioxidants are good. So antioxidants are your C, E, alpha lipoic acid, glutathione, cysteine, As always, I really like nutrient tests so we know what we're dealing with instead of just throwing a bunch of antioxidants at you. Some patients will do well with taking aspirin. Nattokinase and lumbrokinase are also very good. Lumbrokinase is what I chose to take because of its benefits that we already know for Babesia treatment. It is enzymes made from the gut microbiome of earthworms, which is fascinating to me, the genius who figured that out. But if you think of what earthworms do to the soil, it's it's pretty interesting. I mean, earthworms basically help to aerate everything, they're going through and tunneling and doing all this stuff, so I like the idea of some remodeling in my vascular system that's basically getting rid of gunk and opening things up. There's also a plant called Bicalin. Well, it's derived from a plant, it's a supplement. It's got properties that are it's used a lot in Chinese medicine, but it's got help for anxiety. It's been used in cancer treatment, adjunctive, it's got antiviral properties. So Bicalin's another thing. It's also known as skullcap, but that has real benefits in the context of this Pi 1 activity. So those are a few of the highlights of this test and what we can do for it. And it's fascinating what I've found as I've done this for more people. Some people it comes back and there's not a lot of low-hanging fruit. Okay, it's like, "This actually this looks pretty good." You've got a little bit of higher fibrinogen, which is not unexpected in the context of someone who's had an infection for a long time, but you don't have anything genetically going on. Like I said, was very surprised by my results because 'cause I've never had high blood pressure. I have an excellent A1C. I don't have a lot of these other risk factors for heart disease. My actual lipid panel, which is your regular cholesterol test, is excellent. But I found in this test, looking for chronic infection, not just things that are driving these infections, but things that put me at higher risk for heart attack and stroke down the road. But the beauty of it, again, it's not to panic. It's to say, wow, I know this now before I have a heart attack or a stroke or get a clot. So I'm going to go ahead and do things proactively. I've had a few people come back who are ticking time bombs, basically. They have multiple genetic mutations. They've got levels that are super out of whack. I've had a few patients who I thought was interesting who we're ticking a couple of the boxes on the genes, and they have a family history of sudden cardiac death. So, sudden cardiac death, what you're looking at is people who they had an uncle or father or a grandfather who just died of a heart event without warning, and a lot of times these are people that are younger. I found it really fascinating to find patients who had that family history, who we found all these genetic risk factors. So that's actually really exciting because we found out before they themselves experienced sudden cardiac death. Their family doesn't have to go through the negatives. So what someone could do in that situation, I will add a little bit to that, is if somebody's got a really strong family history and they've got all these different risk factors, sometimes I will recommend someone going on a blood thinner as a preventative. So if you know someone who has had stroke or who has had a blood clot, especially when someone has had multiple blood clots, sometimes they'll get put on longer term anticoagulation. So you may have heard of medications like Eliquis or Xarelto. And in the context of someone who has like a genetically disastrous report and all of these other levels that are crazy, that can actually be a really safe choice. I've had some people be turned away from that choice by pharmacists who went a little overboard with side effects. And even though side effects are real, it's really important to recognize context. So if you get put on a blood thinner because you had a heart valve replaced, but you don't have this, this is a kind of pedantic term, but thick blood, if you aren't in this hypercoagulable state, you do have bleeding risk. You're more likely anytime you touch something to bruise, or if you fall and cut yourself to have a hard time stop bleeding, or you fall and hit your head to have a brain bleed. That's true that those are side effects. But if you are a disaster and in a perpetually hypercoagulated state, it's gonna normalize your blood by quote unquote "thinning it," which isn't really a scientific term, but let's go with that because it's easy to visualize. If your blood is really thick, thicker than it should be, and we're thinning it to get it to normal, then you're not looking at all the risks as someone who's just having it because of a mechanical heart valve who didn't have this hypercoagulable state. So I think it's really exciting, even though I know it's a little exhausting for patients to say, "Oh my gosh, one more test." But there's a reason people don't get better, and I don't think it's just because Lyme is so bad or it's impossible to get over Bartonella, you're gonna be sick forever, you're chronic. I just don't believe that has to be the case. I believe there are things that keep us sick, and this is one key that can help us to overcome that. And certainly look at this not just in terms of the vector-borne infections that we talked about, but anybody who's got chronic pain, chronic heart issues, or other chronic infections. Look at COPD. Look at a million different things where somebody's always sick, always has an infection of some sort. There's something that's keeping those things there, and there are tools here in 2025 that can help us be good sleuths, uncover those, and unlock healing. So, if you have questions or suggestions, if you have things that you found helpful in this journey, please shoot us a suggestion, leave a message, but remember to always have hope because you were made to be whole. Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.